Hi, my name is Danny Burgess, and I'm a clinical psychologist here at the Center for Integrative Health. We decided to create a YouTube channel to post videos on topics that are related to overall improving your health and your well-being. So for the next few minutes, I'd like to talk a little bit about just some basic sleep hygiene practices. Now, sleep, as well as our nutrition and our physical activity, is one of the most basic biological processes that we have to be sure that we keep in order and in a routine. And it's important for our overall physical health and our emotional health. Now, we spend about a third of our lives sleeping, but yet we still don't fully understand its biology or how it restores our body. But we have a lot of research on what happens to us physically and emotionally when we don't get enough sleep, when we're sleep deprived. So what I would like to do is spend a little bit of time talking about what happens to us when we're sleep deprived, and then ways that maybe you can improve your sleep behaviors and your sleep habits. Now, when we do not get enough sleep on a consistent basis, we are much more susceptible to a lot of physical ailments and conditions such as hypertension and diabetes. We're more susceptible to cardiovascular disease, and we're more susceptible to increased levels of pain. Besides just the physical things that can happen to us, there's a lot of emotional issues that arise when we don't get enough sleep. We're at more risk for depression, anxiety, anger issues. Our irritability increases. What I like to call is a sort of a low tolerance, high sensitivity to things. So when we don't sleep very well, we have a low tolerance to handle stress in our life and a high sensitivity to other people's emotions and conflict. And so we find ourselves sometimes in a lot of difficult and emotional situations just because we haven't gotten enough sleep. We also have increased levels of experience of pain when we don't sleep very well, and so our ability to tolerate and cope with chronic pain issues is much more difficult when we don't sleep. And the other component that is a part of this is when we don't have good sleep practices and good consistent sleep in our lives, then we're less likely to make good healthy decisions. So when it comes to our food choices, when it comes to engaging in physical activity, engaging in our leisure and social activities, we don't do a very good job of making good decisions when our sleep isn't right. And so as you can see, being sure that you have good sleep and practicing good sleep hygiene is an important thing, not only for us physically, but also for us emotionally. So when you look at your sleep behaviors, the first thing I want you to pay attention to is your sleep environment. So take a look at the place that you sleep, and what you want to look at is things like, as basic as, is my mattress comfortable? Do I have enough blankets or too many blankets? Enough pillows or too many pillows on my bed? What's the lighting situation in the place that I sleep? And what's the noise levels? And so you want to look to see if just at the bare minimum, do I have a good place where I sleep, and what do I need to change in terms of maybe putting drapes over your windows? Or if there's noises that you can't control in your room, then there's things that you can use. There's what are called sound machines that emit this sort of white noise to kind of block out outside noises. And so you may need to think about getting something for your room to help cut down the noise that might be coming from outside, or if you live in the city, or other things that might be creating noise into your room. So you can go to any store that sells these sound machines. They're usually like where the baby sections are, because those are used a lot for outside of baby rooms to block out the noise. So take a look at your environment in terms of your sleep, where you sleep, to see if there's any changes you need to make. You want a cool temperature in that room. Typically they say something about 68 degrees. And so what can be helpful is right before you go to bed, you may bump down your thermostat a couple of degrees just to create a cooler sense in your home or your apartment to help you with sleep, because our body has to cool off in order to get good sleep. So assess your environment and see if there's any changes you need to make there. The next thing is to pay attention is how much do you associate activities with your bed. A lot of times we use our bed for a lot of things. That's where we sit and may pay our bills or get on our tablets or watch TV or read or pay, go through the things that we need to do in terms of our checklist of to-dos. And so we use our bed a lot for a lot of stimulating and awake activities. And by doing that, what you're creating is an association of an awake and active activity in a place that you sleep. So when nighttime comes and you lay down to sleep, your body feels like, oh, this is the place where I do these active things. And so what you want to do is you want to kind of use your bed or see your bed as this sacred space, this sort of sanctuary where you don't do anything on your bed except for sleep. So when it comes to watching TV or reading or doing things on your phone or your tablet, find a separate space to do those activities and then only get into your bed when you're ready to go to sleep. That way you're creating the association of sleep with the bed and not other activities. So kind of watch how you spend your time, especially if you're at home all day long. The tendency is sometimes to get into your bed and do awake activities. Try to find and designate a different spot where you can do those activities and just use your bed for sleep. And then the other thing to pay attention to are just kind of your behaviors that are leading up to your sleep. And that can start as early as the early afternoon, like if you're consuming caffeine. Caffeine stays in our system for a long period of time. And so if you're drinking caffeine, whether it's through soda or tea or coffee or even chocolate, that can stay in our bodies for quite some time and interrupt our sleep. So you want to cut off all caffeine type foods and drinks by early afternoon to give your body a chance to get that out of your system. Nicotine is another stimulating substance that can interfere with your sleep. So if you do smoke, that you want to not engage in that activity right before sleep because it ramps up your body. And then you want to find a routine. The best thing you can do for your sleep to improve it is to have a routine. Have a consistent time that you go to bed. Have a consistent time that you wake up. And I always talk with my patients about kind of finding a buffer between your day and your nighttime and when you go to sleep. And in that period of time, 45 minutes to an hour, you need to reserve as a way to begin to kind of slow yourself down and kind of ease out of your day and move into your nighttime routine. And so about an hour, 45 minutes before, shut off the electronics and don't do any kind of stimulating activities. Don't start paying your bills right before bed. Don't have emotional conversations with your family or with your spouses or partners right before bed. What you want to do is find a routine and a rhythm of behaviors that are relaxing and that begin to kind of disconnect from the world right before bed. And one good thing you can begin to do is to lower the lights in your where you're living, so that your body begins to sense, okay, there's there's less light, so this means that it's beginning to be nighttime and that it's beginning to get ready to do all that it needs to do to get ready to go to sleep. And so it's always a good idea to create that buffer so that you can kind of unwind from your day and then be able to prepare your body and your mind for sleep. So hopefully some of these tips can kind of help you out a little bit to improve your sleep. And when we see that our sleep is better on a consistent basis, then our overall well-being and our overall health is much better. So see if some of those things might work for you. And I thank you for your time, and be sure to take care of yourself.